Thank you, Marika. So good morning, good afternoon. Thank you for joining us. Today I'm here to talk to you about Health Canada's authorization of Pfizer's Paxlovid. Paxlovid is a prescription drug and a combination of two antiviral drugs, nirmatrelvir and ritonavir, for treatment of mild to moderate COVID-19 in adults at high risk of progressing to serious disease, including hospitalization or death. Until now, the medications for treating COVID-19 we have authorized have had to be given intravenously or by injection in a hospital or a healthcare setting. This is the first oral COVID-19 therapy that can be taken by patients at home, which is an important distinction. The treatment consists of 2 tablets of nirmatrelvir and 1 tablet of ritonavir taken together twice per day for 5 days. The treatment is intended for use after a diagnosis of COVID-19 and within 5 days of the start of symptoms. Diagnosis should be made using a positive test on an authorized COVID-19 test confirmed by a healthcare provider. Health Canada received the submission for Paxlovid from Pfizer on December 1st and conducted an expedited review. The authorization comes at the completion of the critical review of the data that was submitted showing that it met Health Canada's safety, efficacy, and quality data standards. Pfizer has been submitting data to Health Canada on a rolling basis throughout the review process, with new information being received as recently as last week. The recent data also included laboratory information confirming the effectiveness of the medication against the Omicron variant. This submission included data from a clinical trial conducted in unvaccinated, non-hospitalized, high-risk adults with COVID-19 infection having symptoms. The study showed that treatment with Paxlovid compared with no treatment reduced the risk of hospitalization and death caused by COVID-19 by 89% when the medications were started within 3 days of the beginning of symptoms and by 85% when started within 5 days. Health Canada's review determined that the benefits of Paxlovid outweigh its potential risks, but it's important to remember that inherently all drugs carry some risks, and this is no different. Paxlovid is a prescription medication. It has the potential to interact with a number of other commonly used drugs in ways that can decrease drug effectiveness or in some cases cause potentially serious effects. As with any prescription medication, patients need to discuss the risks and benefits of treatment with the healthcare provider who is aware of their health conditions and other medications. Following authorization of medication, it's important to continue to monitor both their safety and effectiveness once they start to be used in the healthcare system. Health Canada has applied terms and conditions to the authorization of Paxlovid that require data from ongoing and planned studies to further demonstrate the safety, efficacy, and quality of the medication. For example, there are terms and conditions that require ongoing animal studies to support further assessment of the medication's safety for use in pregnant and breastfeeding women, and monthly post-market safety reports for the next 6 months, as well as updates and results from additional studies. And if any new concerns are identified, Health Canada will take immediate action and communicate with Canadians. The authorization today provides a new tool in the toolkit against COVID-19 at a crucial time in the pandemic as we're faced with new variants. Importantly, it is a more accessible antiviral treatment for those at high risk of progression to severe COVID-19. And while we're here today to talk about this important new treatment option, I also want to remind everyone of the continued critical importance of getting vaccinated. No drug, including Paxlovid, is a substitute for vaccination. And vaccination, along with public health measures, remain the most important tools in preventing illness from COVID-19 infection. Both the Public Health Agency of Canada and Health Canada continue to strongly recommend vaccination for all eligible Canadians. I know everyone will be interested to hear when and how Paxlovid will be made available in Canada, which will be discussed by colleagues later from the Public Health Agency of Canada. Thank you. Merci. Miigwech.
Bonjour. Je vous remercie.
Hello, thank you for being with us today. Today, I will talk to you about Health Canada's authorization of Pfizer's Paxlovid. Paxlovid is a prescription drug and a combination of 2 antiviral drugs, nirmatrelvir and ritonavir. It is designed for the treatment of mild to moderate COVID-19 in adults at high risk of progressing to serious disease, including hospitalization or death. Until now, the medications for treating COVID-19 we have authorized have had to be given intravenously by injection or in hospital or healthcare settings. This is the first oral COVID-19 therapy that can be taken by patients at home, which is an important distinction. The treatment consists of 2 tablets of nirmatrelvir and 1 tablet of ritonavir taken together twice per day for 5 days. The treatment is intended for use after a diagnosis of COVID-19 and within 5 days of the start of symptoms. Diagnosis should be made using a positive result on an authorized COVID-19 test confirmed by a healthcare provider. Health Canada received the submission from Pfizer on December 1st and conducted an expedited review. The authorization comes at the completion of the critical review of the data that was submitted, showing that it met Health Canada's safety, efficacy, and quality data standards. Pfizer has been submitting data to Health Canada on a rolling basis throughout the review process, with new information being received as recently as January. The recent data also included laboratory information confirming effectiveness of the medication against the Omicron variant. This submission included data from a clinical trial conducted in unvaccinated, non-hospitalized, high-risk adults with COVID-19 infection having symptoms. The study showed that treatment with Paxlovid compared with no treatment reduced the risk of hospitalization and death caused by COVID-19 by 89% when started within 3 days of the start of the symptoms, and by 85% when started within 5 days. Health Canada's review determined that the benefits of Paxlovid outweigh its potential risks. But it's important to remember that inherently, all drugs carry some risks, and it is no different in this case. Paxlovid is a prescription drug. It has the potential to interact with a number of other drugs in ways that can decrease drug effectiveness, or in some cases cause potentially serious effects. As with all prescription drugs, patients should discuss risks and benefits of treatment with a healthcare provider who is aware of their health conditions and other medication. As with all medication, it is important to continue to monitor both their safety and effectiveness once they start to be used in the healthcare system. Health Canada has applied terms and conditions to the authorization of Paxlovid that require data from ongoing and planned studies to further demonstrate the safety, efficacy, and quality of Paxlovid. For example, the terms and conditions require ongoing animal studies to support further assessment of the drug's safety for use in pregnant and breastfeeding women, and monthly post-market safety reports for the next 6 months, as well as an updated risk assessment as results are submitted from additional studies. If any new concerns are identified, Health Canada will take immediate action and communicate with Canadians. The authorization today provides a new tool in the toolkit against COVID-19 at a crucial time in the pandemic as we are faced with new variants. Importantly, is it important to note that this is a more accessible antiviral treatment for those at high risk of progression to severe COVID-19. And while we are here to talk about this important new treatment option, I also want to remind everyone of the continued critical importance of getting vaccinated. No medication, including Paxlovid, can substitute vaccination. Vaccination and public health measures remain the most important tools in preventing illness from COVID-19 infection. Both Public Health Agency of Canada and Health Canada continue to strongly recommend vaccination for all eligible Canadians. I know everyone will be interested to hear when and how Paxlovid will be made available in Canada, so I will hand things over to my colleagues from the Public Health Agency of Canada. Thank you.
Bonjour. Hello.
Hello.
It's my pleasure to be here with you and my colleagues, Dr. New, Dr. Sharma, and Dr. Betium. Throughout this pandemic, the Government of Canada has taken the responsibility to procure COVID-19 therapeutic products to ensure that Canada has early access to safe and effective treatments. Since the onset of the pandemic, several different types of treatments have been developed to help reduce the severity of COVID-19. COVID-19 treatments, along with vaccinations and public health measures, are essential to save lives, reduce illness, and lessen the burden on our healthcare facilities. And today, Health Canada announced it has authorized Paxlovid the first COVID-19 therapy that can be taken at home. The treatment is the combination of two antiviral drugs, nirmatrelvir and ritonavir. The Public Health Agency of Canada works with Public Services and Procurement Canada to secure access to safe and effective COVID-19 treatments. Today's announcement is particularly important, as access to easy-to-use treatments could help to reduce the severity of COVID-19 in adults who become newly infected and are at high risk of progressing to serious illness. In December, the Government of Canada signed an agreement with Pfizer for an initial quantity of 1 million treatment courses of Paxlovid. While there is currently limited global supply on Paxlovid, we are working to firm up a delivery schedule with the intent of bringing treatment courses to Canada as quickly as possible. Ministers Duclos and Tassi will provide further details on the distribution of the treatment later this afternoon. Provinces and territories will determine how best to manage the available supply with support from the Public Health Agency of Canada. The Public Health Agency of Canada met with provincial and territorial colleagues to discuss deployment based on a per capita basis, with adjustments that take into account shipment requirements from Pfizer. To help inform their planning, the Public Health Agency of Canada has provided provinces and territories with interim implementation considerations for the deployment of the initial supply of Paxlovid to treat COVID-19 in the context of supply limitations. These interim recommendations are based on clinical risk factors and health equity considerations. First consideration is prioritizing individuals who are at the highest risk for severe illness and hospitalizations. Individuals in the following categories have the highest likelihood of severe illness and should be given priority for treatment given limited supply. First, those who are moderately to severely immunocompromised, not expected to mount an adequate response to SARS-CoV-2 infection, regardless of vaccine status. Secondly, individuals over 80 years of age or over whose vaccinations are not up to date. And third, individuals 60 years of age or older residing in underserved, rural or remote communities, residing in a long-term care setting, or those living in or from First Nations, Inuit, and Métis communities whose vaccinations are not up to date. Our second consideration is to make a greater supply available for use in rural and remote communities where there is limited access to tertiary care, and in situations where social and economic determinants of health, such as food insecurity, inadequate housing, and a higher level of pre-existing medical conditions may exacerbate health inequalities. The third consideration is that infection must be confirmed and treatment initiated within 5 days of symptom onset. If PCR testing is not possible, or if results will not be available until more than 5 days from symptom onset, rapid antigen tests may be used. Drug interactions and access to alternate effective COVID-19 treatments are also factors to consider. I would like to provide a reminder that no drug, including Paxlovid, is a substitute for vaccination or public health measures. This is another tool in the toolkit to fight the pandemic. It is important that everyone gets fully vaccinated and receive a booster dose as soon as they are eligible. Over time, our immune response from various vaccines decreases. A booster dose produces more antibodies along with other immune cells, help to strengthen our immune response to protect against severe illness. Finally, Canadians are reminded that both mRNA vaccines currently available are safe and effective and help protect against severe outcomes from COVID-19. Therefore, they should feel confident in accepting whichever vaccine is offered to them. Both the Public Health Agency of Canada and Health Canada continue to strongly recommend vaccinations for all eligible Canadians, including those who are pregnant, may become pregnant, or are breastfeeding. As always, vaccination, including a booster dose, is the best way to protect yourself, your families, your communities against severe outcomes from COVID-19. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello, everyone. It is my pleasure to be here to be with you with my colleagues Dr. Tam, Dr. Berthiaume, and Dr. Sharma. Throughout this pandemic, the Government of Canada has taken the responsibility to procure COVID-19 therapeutic products to ensure that Canada has early access to safe and effective treatments. Since the onset of the pandemic, several types of treatments have been developed to help reduce the severity of COVID-19. COVID-19 treatments, along with vaccination and public health measures, are essential to save lives, reduce illness, and lessen the burden on our healthcare facilities. Today, Health Canada has announced that it authorized Paxlovid, the first COVID-19 therapy that can be taken at home. The treatment is the combination of two antiviral drugs, nirmatrelvir and ritonavir. Canada is one of the first countries to grant market authorization of Paxlovid. The Public Health Agency of Canada, with Public Services and Procurement Canada, has been working together to secure access to safe and effective COVID-19 treatments. Today's announcement is particularly important as access to easy-to-use treatments could help reduce the severity of COVID-19 in adults who have become newly infected and are at high risk of progressing to serious illness. In December, the Government of Canada signed an agreement with Pfizer for an initial quantity of 1 million treatment courses of Paxlovid. While there is currently limited global supply of Paxlovid, we are working to firm up a delivery schedule with the intent of bringing treatment courses to Canada as quickly as possible. Ministers Duclos and Tassi will provide further details on the distribution of the treatment later this afternoon. Provinces and territories will determine how best to manage the available supply with support from the Public Health Agency of Canada. The Public Health Agency of Canada met with provincial and territorial colleagues to discuss deployment based on a per capita basis with adjustments that take into account shipping requirements from Pfizer. To help inform their planning, the Public Health Agency of Canada has provided provinces and territories with interim implementation considerations for the deployment of initial supply of Paxlovid to treat COVID-19 in the context of supply limitations. The following interim recommendations for deployment of the initial supply of Paxlovid were provided to provinces and territories are based on clinical risk factors and health equity considerations. We want to prioritize individuals who are at the highest risk of severe illnesses and hospitalization. Age is the strongest risk factor. We're going to focus on certain categories. For example, people who have moderate or severe immunocompromised systems, especially if they're more vulnerable to SARS-CoV-2. We will also focus on people whose vaccinations are not to date. Also, people aged 60 and up in rural or remote areas that are underserved, in long-term care facilities, or members of First Nations, Inuit, and Métis communities whose vaccinations are not up to date. The second consideration is to consider making a greater supply available for use in rural and remote communities where there is limited access to tertiary care, and in situations where social and economic determinants of health, such as food insecurity, inadequate housing, and a higher level of pre-existing medical conditions may exacerbate health inequalities. Third consideration, infection must be confirmed and treatment initiated within 5 days of symptoms onset. If it's not possible to get a PCR testing, or if results only arrive after 5 days of symptom onset, rapid antigen tests may be used. Drug interactions and access to alternate effective COVID-19 treatments are also factors to consider. We would like to remind you that no drug, including Paxlovid or another substitute, can replace vaccination or other public health measures. This is just another tool in the toolkit to fight the pandemic. It is important that everyone be fully vaccinated and receive a COVID-19 booster shot as soon as possible. Over time, our immune response from vaccines decreases. A booster dose produces more antibodies, which, along with other immune cells, help to strengthen our immune response to protect against severe illness. Finally, Canadians are reminded that both mRNA vaccines currently available are safe and effective and help protect against severe outcomes of COVID-19. Therefore, they should feel confident in accepting whichever vaccine is offered to them. Both Public Health Agency of Canada and Health Canada continue to strongly recommend vaccination for all eligible Canadians. This includes people who are pregnant, who may become pregnant, or who are breastfeeding. As always, vaccination, including a booster dose, is the best way to protect yourself, your families, and your communities against severe outcomes from COVID-19. Thank you. Merci. Miigwech.
Okay, thank you so much, doctors. As there are no questions in the room, we'll turn it over to the telephone lines. We have until noon today for questions and answers, so please keep that in mind. So more people, the shorter the question and the answer, the more people can get a question. And over to you, operator.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Ryan Tumilty from the National Post. Please go ahead.
Yeah, hi there. So I'm wondering, in practical terms, how you see this drug being dispensed. I assume that to get a prescription for it, someone will need a positive COVID test, and there's such a shortage and delay in those. And with the fact that they have to get the drug within a few days of treatment, I wonder if you see a lot of practical barriers to people actually being able to use this drug.
It's Dr. Yu. Maybe I could start.
Oh, sorry, I was on mute.
It's okay. Go ahead, Dr. Tam.
Sorry about that. So I think there are definitely key operational considerations on the ground, and provinces as well as the clinical networks and the system are thinking through that right now. And they have been doing so, for example, for the utilization of some of the other treatments like sotrovimab. So this is not starting from scratch. They have been looking at how do you actually provide these treatments to those who most need it. And so I think the PCR testing and testing in general by the provinces and territories have been prioritized to the high-risk groups. So they will likely consider doing that as well. So that actually aligns with the prioritization of treatments, is that the testing is being prioritized for higher risk individuals. But you're right in that there's many innovations on the ground that are being thought about right now, and using, for example, community pharmacies, designated prescribers, making sure that testing centers, for example, can direct people to the right clinical expertise, and also setting up reference expertise. For example, Dr. Sharma and us, we've mentioned the issues with drug-drug interactions. So if you're on certain medications, you have to be careful when you're using this drug. And for that, the pharmacists as well as clinical experts have been discussing how best to provide that reference reach back so that frontline prescribers will know what to do.
It's Dr. New. Maybe I can just add some additional points to what Dr. Tam has said. As you can see from our opening remarks, the Public Health Agency of Canada has developed a document for considerations by our provinces and territories in terms of the deployment of this treatment, which we appreciate was probably in a sort of initial limited supply. And certainly I want to give a shout out to the clinical experts of this ad hoc group we put together that really gave their valuable time and expertise. They're on the ground on the front lines, and they gave us a bit of a reality check in terms of the practical issues that they'll be facing on the ground in terms of delivery of healthcare. And so with their input, we developed the considerations, as you can see in the document, which I understand will be posted, I think, publicly on our website, if not already, shortly, that gives that initial sort of considerations to the provinces and territories, recognizing that, the way healthcare delivery is set up in each of the jurisdictions is slightly different and takes into account as well unique aspects such as, the proportion of, remote isolated communities, social determinants, and so on. So with all that in the mix, hopefully the guidance we give in terms of considerations will be used to good effect by the provinces and territories as they move forward with the initial deployment of this treatment. Thanks.
Yeah, maybe just as a follow-up, I'll ask this question a bit more directly. As I understand it, the way the drug works, someone would have to develop symptoms, see a doctor, get a test, get a prescription, get the test results back, and get the drugs and start the treatment all within 5 days for it to be most effective. Given the current situation in Canada, do you think it's likely someone will be able to do that?
Dr. Tam?
Yes, so as I said, that I think these drugs, these treatments, this first treatment that is taken orally and can be taken at home will be in high demand. And there are mechanisms being set up right now to make sure that individuals in these high-risk groups, for example, clinicians looking after those who are moderately or severely immunocompromised, are getting themselves ready to respond to the needs of that group, and those in long-term care and other places as well. So I do think that the criticality at the moment is really, nobody in the world has enough supply. But I do think implementation, if you recall right at the start of the vaccination campaign, the initial doses were relatively small, but it gave us a chance to essentially get all of the system rehearsed and ready for when there's more supply. So I kind of see the initial doses as being just part of that system testing itself out and getting itself ready.
Yeah, it's Dr. New. Maybe I can just add, if you look at the sort of the highest risk groups in terms of the elderly, especially in certain settings, certainly what we appreciate from the clinical experts who gave us their best input and advice on the ground is that that's what is being looked at within the various provinces and territories. They're already, I think, being sort of prioritized for even testing. So if you were a clinician on the ground dealing with patients in those high risk groups, immunocompromised, elderly, and so on, certainly if someone develops symptoms, I think certainly I can't speak for the provinces and territories, but I would think that those individuals would be at sort of close to top of list to get that rapid sort of assessment, that test and results, and then hopefully be given the medication as per sort of the way the provinces and territories are going to use this treatment. Thank you.
Thank you, merci. La prochaine question de Louis.
Next question from Louis Blouin, Radio-Canada. Hello, this question is either for Dr. New or Sharma. According to what we know, this antiviral drug needs to be administered early to be effective. But we're struggling currently to access testing. Will it make a difference if testing is not accessible, considering that you have to go to the doctor, get a test quickly? Will it practically be possible to get this drug?
Merci pour la...
Answer. Thank you for the question. This is Dr. New. Maybe I will start. Indeed, this is another tool in our arsenal. It's something we can add to our vaccination program and other public health measures. What I think is that currently in provinces and territories, healthcare providers on the ground are aware of who is among high-risk groups. So it really is up to provinces and territories, but they are currently developing plans to test higher-risk individuals, and this is part of their planning in order to be ready to administer this medication early from the onset of symptoms for people who have immune system issues, people who are aged 80 or even 60 and up, especially if they're not up to date with their vaccination. Dr. Tam adding, we can use rapid testing as well if it's not possible to access a molecular test. Thank you for this specification. There are many ifs right now. I would like to know, when do you think these antiviral pills will make a difference in lightening the load for our healthcare system? When will we feel the difference that they will bring? Answer. Here this Dr. New. Maybe I can start. We're hoping to add this tool to our toolbox. But if we can prevent people who contract COVID-19 from developing severe illness that would lead to hospitalization or even intensive care admission, that would be the goal. So I think it's very important to focus the initial deployment of this treatment to the right people. We'll also need to see what will happen to these people who are treated with the antiviral. Will they avoid hospitalization? It's currently important also to see what the profile is of people who are currently hospitalized. This could give us clues to identify which types of people would best benefit from this type of treatment and to avoid hospitalization. At the end of the day, our objective is to lighten the load on our healthcare system. This is why we keep emphasizing vaccination as an important tool in our toolbox, including following public health guidelines. We're trying to reduce hospitalizations and lighten the load on the healthcare system. So this is an additional tool.
Mia Rapson from the Canadian Press. Please go ahead.
Yeah, hi. I'm just wondering, going back to sort of what Ryan was asking about, we know, for example, that it's really hard to get testing done right now. These priority groups that you're talking about are supposed to be prioritized for that, but even getting rapid tests can be difficult. So can we sort of revisit this issue of how easy it's going to be to actually get this to people within 5 days, the practical realities of that?
Yes, Teresa Tam. So again, that has to be worked out on the ground, but it is challenging. There is no doubt about it. First of all, spotting that you may have symptoms and then getting medical attention quickly. So I do think increasing awareness to the at-risk populations that there may be treatments available now, even though, we anticipate at the beginning the supply is not going to be great anywhere. But I think one is public awareness, that if you're in these categories, and do pay attention to the provinces when they announce who they're going to be supporting initially. And then follow the instructions that are provided, because each community is going to be a little different in terms of how they're going to roll this out. As I said, there's initiatives on the ground to try and facilitate the implementation, but there is no doubt that one of the key challenges of these antivirals is to the fact that they have to be given really early on in the course of the clinical course. So not easy, but again, I think everybody really just needs to give it a good try, because it would be, I think, an important tool going forwards.
Some people have talked about this drug before as the so-called game changer in the treatment of the pandemic. Obviously, supply issues would have to come up in order for any real impact. But I'm just wondering if you can talk about what this really means towards going from this sort of intense stage of the pandemic to a more endemic phase.
Well, I think given one of the key goals is to reduce the severity impacts of this pandemic, this kinds of treatment that people can take at home, and unlike some of the monoclonal antibodies that have to be given by several infusions at a clinic or a healthcare setup, this is going to be much easier to do. But the challenges that you've identified just now are continually going to be challenging. So one hopes that the testing as well as the rapid deployment will be worked out in the coming weeks and months. But it will definitely add another really important tool, because it would potentially blunt the severity of the illness, which is the key goal. And it also offers those who don't mount a response to vaccination or couldn't get vaccinated for whatever reason, who are at the highest risk of severe outcomes, hope, as well as the reduction in the pressure on the health system.
Thank you. Merci. La prochaine question est de
Olivier Ferrand-Boissé from TVA Nouvelle. You have the floor. Thank you for taking our questions. For Dr. Berthiaume, you were talking about the efficacy of the treatment after a given number of days. Is there a moment where the symptoms become too intense for the medication to win? Thank you for your question. The medication was approved for light to moderate forms of illness within the first 5 days of onset of symptoms. COVID-19 illnesses generally generates mild to moderate symptoms early on. So following a positive test, we can take the medication. Once you get beyond this window, the antiviral treatment can't be used because we have no data on its efficacy. But for people who have mild to moderate symptoms, which is what we expect in early days of the infection, Paxlovid can be prescribed and used. Follow-up question. I would like to touch on accessibility again. Dr. Tam was talking about the fact that rapid tests can be used as well to confirm an infection in order to get access to the medication. Is that it? Can you just get a positive rapid test result in order to go get the medication simply with the rapid test as evidence? I will let the Dr. New answer the question with regards to test distribution. But yes, you should get a rapid test or a PCR test. It could be a molecular test or a rapid test, one or the other. As rapid tests are specific, they would give one access to treatment. I don't know if Dr. New has additional comments. Answer, Dr. New. Yes, thank you, Dr. Berthiaume. I would like to add one thing. Our expert group has underscored the fact that it's important to have a laboratory test before initiating treatment, because this is a medication that is available in limited supply. We have to make sure the patient truly does have COVID-19. So like Dr. Bertillon said, in this context, it can be a molecular test or a rapid test or an antigen test, but the result has to be positive before treatment is initiated. This is what the experts have recommended. It's an important principle, and that's why we included it in our document's considerations. Dr. Bertillon adds, I'd also like to specify that this is not a treatment for people who are already hospitalized. This is really meant to be used in the first 5 days of symptoms. Once you've reached severe symptoms, severe illness, we have no data as to the efficacy. So it's really most beneficial in the early stages of illness.
Oh, sorry.
I'm going to say someone, can you put...
Dr. New adds, yes, we have a variety of treatment options in Canada. There are hospital treatments for those who have severe illness. And now with Paxlovid, we have another tool that is meant to avoid hospitalization and even intensive care treatment. So it's important to use all of the tools we have at our disposal to fight COVID-19. Thank you.
Thank you. Merci. The next question is from Abigail Biman from Global News. Please go ahead.
Hi, thanks for taking my question. I just want to understand a bit more when you talk about people who are not vaccinated being on the priority list. I'm wondering what kind of discussions there have been around, the limited amount of this drug and how expensive it is, and whether people who choose not to get vaccinated should be put on a priority list.
Yes, this is Teresa Tam. So this is a scientific and rational use of the drug that is in short supply. We know that the unvaccinated are at higher risk of getting severe outcomes and getting hospitalized and ending up in the ICU. So this is the evidence, and we're following that evidence. And so I think that as healthcare providers, you don't pick and choose which patients you have coming into the hospital and getting treated. And so I think this approach ensures that we are prioritizing treatments to those most in need. And I really appreciate the input from the experts, including the ethicists, who contributed to this discourse. And the priority groups you have now represents the collective efforts at laying down not just the clinical criteria, but the ethical considerations, as well as health equity.
Thank you. I also want to ask, given there's such a long list of people who shouldn't take this drug due to being on other medications or having specific conditions, that long list seems to overlap with the population you would deem to be at highest risk. So I'm wondering, sort of in layman's terms, if you can describe how accessible this drug would be to high-risk populations. Like, would you say most high-risk people could take this drug, or is it only a small percentage of those at high risk to COVID? How helpful will it be?
So maybe I'll start, and I'm not sure if Dr. Sharma or others will add. Yes, according to the product monograph, one of the key considerations is the interactions with other drugs. So the key is that this is a prescription medication because that's one of the key considerations. So I can't tell you percentage-wise exactly how many of the high-risk groups will be on that list of drugs. I don't have that figure. But I do think that it's absolutely worth consultation with health providers and not be scared to deploy this drug either. The expert pharmacists, as well as physicians and other health providers, will be able to work this through with the patients.
And perhaps just to add, the way that the medication works is that there's one part that actually interrupts the way that the virus reproduces, and then there's another medication that blocks the breakdown of that drug, and that's the ritonavir part. And because of that, ritonavir is there. That's why there are so many drug interactions. But that's not unique to this medication. So there's a group of about 27 drugs where we're saying the product should not be used if somebody is on those drugs, and then a much longer list of products where there might be some interactions. And you're right that if you have people at higher risk, so if people are in the older age group or have other illnesses, they're more likely to be on those medications. But that's why we put all the information out on these drugs so that the pharmacists are aware, the healthcare practitioners are aware, and people are aware of which medications that they may be on that might interact. And it might be, because this is a short course, it's a 5-day course, it may be that some of those medications could be stopped for a short period of time, or there may have to be some dosage changes. So it really is the way that we look at all medications. If there are considerations on how they should be prescribed or how they're best to be used, we want to make sure that all that information is out there so that people are aware of that, and then they can make their healthcare decisions appropriately.
Thank you. Merci. La prochaine question.
The next question is from Alice Girard-Bossé from La Presse. Hello, I'd like to know, will this medication need a prescription from a doctor? Could a pharmacist write a prescription? Answer. I'd like to start, and maybe Dr. New can add something after. So this is a prescription drug. Depending on the province, it will have to be prescribed with someone who has prescription privileges is in one province, in the province, and this varies from province to province. It can be delegated to other professionals, so it's not necessarily a doctor. And there are also some provinces that have delegation of prescribing privileges to other professionals. So everything will depend on context. But what you need is a healthcare professional who can assess medical interactions. As we mentioned earlier, this product interacts with other drugs, and you have to assess the patient's conditions, recommendations, other medications that the patient is taking, because it's possible that other drugs could be temporarily halted because it's still only a 5-day course. I'll let Dr. New jump in if there's anything else to add. Dr. New, have nothing else to add. I'm completely in agreement with what Dr. Berthiaume has said. Follow-up question. You mentioned drug interactions. What are the contraindications for this treatment? Dr. Berthiaume, your microphone is off. Answer. There is a long list of medications, so it would be a little tedious to list them all here now. But what I can say is there are 19 classes of medications that include 37 different molecules that are contraindicated. So we wouldn't recommend administering both at the same time as Paxlovid. There's an additional group of about 120 medications that includes multiple pharmacological classes that might have an interaction. We might have to adjust dosing. So it's a medication that's slightly complex to administer because of drug interactions. That said, doctors and pharmacists are used to this, generally speaking, and they know how to adapt for contraindications. Many of these problems have a solution, but it does require clinical pharmacological expertise. As I said, there is a long list of medications that are contraindication. The monograph has been updated online if you want to see all of the data, but there is a long list of medication that is contraindicated.
Thank you, merci. The next question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead.
Hi, Dr. Tam. Is it not inequitable to distribute this resource on a per capita basis when we know that certain provinces and territories have much higher proportions of immunocompromised and rural patients and much lower hospital capacity?
Dr. Tam, would you like me to?
Sure, you go ahead and I can supplement if needed.
Okay, well, thank you for the question. The reason I'm jumping is that I've been sort of more at the programmatic level, logistical level, working with our counterparts in the provinces and territories. So maybe I could just start with sort of the principle of the per capita allocation. It's a starting point in terms of distributing the treatment, obviously courses across the country. But it's also been taken into account the fact that there are certain populations, for example, Indigenous populations that are also having different proportions within the provinces and territories. So that's also been taken into account. There's also been for example, a certain allocation given to Indigenous Services Canada, obviously to look at specific settings, for example, remote nursing stations and so on. So that's a part of sort of the complexity of how we're actually going to allocate. And obviously, we'll see as we go along in terms of any adjustments that need to be made in terms of demand and need with our provinces and territories. But sort of as the starting principle, it's just easier to state that we're doing on a per capita allocation. But obviously, there's a lot of detail and other sort of nuances that we're working on behind the scenes. Thank you.
It's Marika Walsh in Ottawa. We have time for one more question and a follow-up.
Sorry, do I get a follow-up too?
Oh, sorry, Dylan, yes.
No, it's okay. I hope Indigenous Services Canada provides that number today. And Dr. Sharma, can you please explain how this is related to the monoclonal antibody treatment? Is there any sort of clinical guidance for when the antibodies are best versus the pill, or is it solely on a question of logistics and distribution?
All right. So, all of the treatments that we have, whether they're for, so a lot of the monoclonal antibodies are really for a subgroup of patients with COVID-19 that are actually in hospital or quite severely ill. And that's once you've had the illness, it's been established to have those treatments help to decrease the severity of illness. This is a medication that, because it blocks the replication or the reproduction of the virus, that's why you need to catch people early. So these are for people who have been exposed to COVID-19. They have some symptoms that have started. They've got a positive test, and it's really to prevent them to progressing to requiring hospitalizations or intensive care. We do have other long-acting monoclonal antibodies that we have under review. So one of those products is Evusheld, and that is used even before you have any symptoms. So basically, you don't have COVID yet, and it's really a long-acting monoclonal for prevention. So, we also have other medications that are treating severe people in hospital. We've got the remdesivir that's been authorized, the sotrovimab as well, and other medications like steroids. So, that's why it's it's a toolkit that we have of different therapies. It's still best, obviously, to prevent infection overall. So getting vaccinated is still the best prevention in terms of COVID illness, especially severe illness, hospitalization, and death. We know that the vaccines, even in this Omicron wave, are very effective against that. But really, there are some groups that potentially don't have that immune response, either because they are unvaccinated, under-vaccinated, or they have an immune problem, or they have other risk factors. So this is really one medication in that area to try to prevent hospitalization and death.
Thank you, merci. The last question will be from Travis Danraj from CBC News. Please go ahead.
Thank you. My question is for Dr. Tam or Dr. Sharma. Rapid antigen tests, you said, would be a sufficient diagnostic tool if no PCR is available. Now, we know experts have said that these rapid antigen tests are sometimes unreliable. For a drug where supply will be limited, at least to begin with, wouldn't it be more prudent to only prescribe it to those that have a positive PCR result?
Yes, the challenge with this medication is to get the test done early. And I think the principle that was being worked out in the consideration document is that, yes, you can try and get the PCR test, but if it's simply not available or not available fast enough, then the rapid antigen test may be used. That's just a very practical approach. Yes, rapid antigen tests may have their limitations, but they are there in greater availability in certain settings. So I think use whatever tool you have on hand. But the key is that given the supply and given the need for a prescription and to direct therapy appropriately, getting that test right now is considered an important consideration.
And perhaps to add with respect to the test, just with respect to the test, the rapid antigen test, I think, some of the issues around how effective they are really are for what we call false sort of negatives. Basically, if you actually do get a positive test on a rapid antigen test, that is quite specific. I think the concerns are that they're not as sensitive as the PCR test. So potentially, it wouldn't necessarily pick it up if it's earlier. In that case, a PCR test might pick up a positive earlier than a rapid antigen test. But if you have a positive rapid antigen test, it's actually very accurate, which is why it can be used in terms of the indication for using Paxlovid.
Yeah, and it's Dr. You maybe had a final point in terms of rapid antigen tests. Certainly, I think the limitations a lot of experts are talking about is in the context of someone is asymptomatic or has no symptoms at all, and sort of the kind of the rate of false results you would get from that. But certainly in the context of someone who is developing symptoms, the actual sort of what we call the pretest predictive positive result is much higher. So I would say that certainly PCR would be ideal, but I would say that in the context of someone who's symptomatic, it certainly is acceptable to have a rapid antigen test and would give a good results in terms of then deciding whether you need to maybe be eligible for this treatment or not. Thanks.
Thank you. And just as a follow-up to Dr. Tam, I'm wondering if you can kind of zoom out here, big picture. If we look at this drug over the next couple of weeks, how much of an impact is it going to have on this wave that we are dealing with right now, and how much is this a forward-looking drug?
Yes, I think a lot of it depends on the initial supply, and we all know that the supply isn't going to be great at the start. So for the Omicron wave itself, it may contribute, but it won't be a key contributor to the current wave. So it is very much another layer, another tool as we progress over the next months, and hopefully with other treatments as well. But I think just to end the press conference on a positive note, this is great news overall. The regulator, as well as the experts helping us with the guidance and the supply are all coming together at once, and I think Canadians should be very happy today to hear that the oral antivirals are beginning to become available in Canada.
Okay, this ends the press conference with the doctors. The ministers, Duclos and Tassi, will be available at 1:30 this afternoon. Thank you so much.
Thank you.